Hello and welcome to my channel. In this video we will be looking at AQA Alevel Psychology 2021 Paper 1 Examplar Answers for Psychopathology, which you need to know for AQA Alevel Psychology. I hope you enjoy this video and find it helpful. Let's get started. Please note that these answers have been produced with knowledge of the mark scheme but have not been approved by the mark scheme themselves. There are 3 assessment objectives, AOs, in psychology. In this video they are color-coded. AO1 Knowledge, purple. AO2 Application, blue. AO3 Evaluation, red and green. Question 1. Identify 2 behavioral characteristics of depression. 2 marks. One behavioral characteristic of depression is change in activity levels. Energy levels can be reduced, resulting in increased lethargy and fatigue, which causes an individual to withdraw from activities such as work, education, and social life, and in extreme cases causes the inability to get out of bed and neglect to personal hygiene, less washing, wearing clean clothes. Energy levels can be increased, psychomotor agitation, which causes individuals to struggle to relax. Behaviors shown include individuals pacing up and down their room. A second behavioral characteristic of depression is disruption to sleep, may be reduced, insomnia, e.g. prematurely waking up, or sleep may be increased, hypersomnia, e.g. oversleeping. Question 2. Briefly outline one way that a cognitive psychologist might treat depression by challenging irrational thoughts. 2 marks. Ellis Rational Emotive Behavior Therapy, REBT, introduced CBT and expanded his ABC model of depression to the ABCDEF model, including dispute, effect, and feelings. The therapist disputes irrational beliefs with effective ones, using logical, empirical, or pragmatic disputing techniques. The treatment is usually short, between 16 and 20 sessions, with techniques like challenging irrational thoughts and behavioral activation. Challenging automatic negative thoughts helps patients link thinking to emotions and record emotionally arousing events. They challenge negative thoughts with more positive ones, questioning logic, evidence, and pragmatism. This objective thinking replaces dysfunctional thoughts with constructive ones, improving emotional state. Behavioral activation links activity to positive rewards, helping alleviate depressive symptoms. Depressed people often withdraw from pleasurable activities. The therapist helps patients identify enjoyable activities and challenge negative thoughts to encourage activity. Shame-attacking exercises intentionally provoke shame in a controlled way, allowing people to challenge and change negative thoughts associated with those feelings. Question 3. Describe the biological approach to treating obsessive-compulsive disorder, OCD. 4 marks. Biological treatments for OCD aim to restore biological imbalances. Drug treatments for OCD are based on the assumption that chemical imbalances in the brain are the cause of OCD problems, aiming to correct the imbalances of neurotransmitters. By adjusting the levels of neurotransmitters, these treatments can help decrease anxiety, lower arousal, and reduce blood pressure or heart rate. Selective serotonin reuptake inhibitors, SSRIs, include sertraline, 6-8, fluvoxamine, 8 and over, and fluoxetine, Prozac, for adults. SSRIs are used based on the theory that low serotonin levels play a role in influencing OCD. SSRIs tackle the symptoms of OCD by blocking receptor cells and inhibiting the reabsorption, reuptake, and breakdown of serotonin, which is released from the presynaptic neuron into the synapse from neurons, prolonging the serotonin's activity in the synapse in order to ease the transmission of the next impulse and continue stimulating the postsynaptic neuron and reduce anxiety and normalize the worry circuit. SSRIs take 3 to 4 months of daily use to impact upon symptoms. Question 4. Discuss statistical infrequency and deviation from social norms as definitions of abnormality. 16 marks. Statistical infrequency is defined as abnormal behavior, thinking or traits that are statistically or numerically rare, uncommon, or anomalous within a population. It relies on the use of up-to-date statistics and focuses on the quantity of behavior measured in standard deviations from the mean rather than the quality, occupying the extreme ends of a normal distribution curve. For example, low IQ is defined as an intellectual disability disorder, but high IQ is also defined as an intellectual disability. A strength of statistical infrequency as a definition of abnormality is that defining abnormality using statistical criteria can be appropriate and effective in many situations. For example, this approach allows for a clear and objective measure of behavior, making it easier to identify individuals who may need help. By quantifying behaviors and mental states, it provides a systematic way to differentiate between normal and abnormal functioning. This can be particularly useful in clinical settings, where mental health professionals can use statistical data to inform diagnoses and treatment plans. Additionally, it can aid in the identification of rare disorders that may require specialized intervention, ensuring that individuals receive the appropriate support tailored to their specific needs. This is a strength because it suggests that statistical infrequency provides a reliable framework for identifying abnormal behavior, which can lead to timely and appropriate interventions. By using objective data, mental health professionals can make informed decisions about diagnoses and treatment, ultimately improving outcomes for individuals who may otherwise go unnoticed. Additionally, it helps create a standardized approach to understanding mental health, which can be beneficial in research and clinical practice. A limitation of statistical infrequency as a definition of abnormality is that some disorders are not statistically rare. For instance, conditions like anxiety and depression are relatively common in the general population, yet they can still be considered abnormal in terms of functioning and behavior. This means that using statistical infrequency alone can lead to mislabeling individuals who experience common psychological issues as normal, while overlooking those who may have rarer conditions that significantly impair their daily lives. Furthermore, this definition does not take into account the social context or cultural norms, which can vary widely. This is a limitation because it suggests that the definition of abnormality may be too simplistic and fail to capture the complexities of mental health issues. By relying solely on statistical infrequency, it overlooks the importance of context, individual experiences, and the subjective nature of what constitutes abnormal behavior. This could lead to inadequate support for individuals who are struggling with common yet significant psychological conditions. Deviation from social norms is defined as abnormal behavior that goes against or contravenes laws, unwritten rules, or expectations in a given society, culture, or situation. Therefore, any behavior that does not conform to accepted or expected standards is abnormal. For example, respect for human life, queuing at a bus stop, greeting etiquette, dress codes, personal space. A strength of deviation from social norms as a definition of abnormality is that it can help to protect members of society. Norms within societies are usually developed and designed to help society function adequately. When individuals exhibit behaviors that significantly deviate from these norms, it can signal potential risks not just to themselves but to others as well. For example, behaviors that are considered harmful or dangerous may prompt intervention from mental health professionals, law enforcement, or community support systems. By addressing these deviations, society can ensure a safer environment for everyone. This protective aspect is particularly important in maintaining social order and preventing harm. Additionally, it can lead to the development of support systems that assist those struggling with mental health issues, ultimately fostering a healthier community. This is a strength because it suggests that deviation from social norms can serve as an important indicator of behaviors that may require attention or intervention. By identifying these deviations, society can take proactive steps to support individuals who may be struggling, ensuring that they receive the necessary help while also maintaining the safety and well-being of the community as a whole. A limitation of deviation from social norms as a definition of abnormality is that it suffers from cultural bias. This means that what is considered normal behavior can vary significantly across different cultures. For instance, certain behaviors that are accepted and celebrated in one culture may be viewed as abnormal or deviant in another. This cultural perspective can lead to misunderstandings and misdiagnoses when mental health professionals apply a universal standard based on their own cultural norms. For example, Cochrane, 1977, found that black people were more commonly diagnosed as schizophrenic in the UK compared to white people or Asians. However, Jamaica, a country that has a predominantly black population, has very low diagnosis rate for schizophrenia. Moreover, this bias can marginalize individuals from minority cultures, making them more vulnerable to being labeled as abnormal simply because their behaviors or beliefs do not align with the dominant culture's standards. This limitation suggests that behaviors labeled as abnormal may not accurately reflect an individual's mental health but rather the cultural biases of the observer. This raises ethical concerns about the fairness and accuracy of using social norms as a standard for abnormality, as it overlooks the rich diversity of human experiences. Such a viewpoint can lead to inappropriate labeling, where professionals might disregard the cultural context of certain behaviors. Consequently, relying on this definition can perpetuate stereotypes and increase stigma against marginalized groups, ultimately hindering effective mental health support and treatment. Thank you for watching. If you have enjoyed this video, please like and subscribe for more content like this. Bye.